Discover the life-saving power of Plavix with our comprehensive guide. Whether you're a healthcare professional or a patient seeking information, this video will provide you with a detailed understanding of this medication and its benefits. Plavix, a commonly prescribed antiplatelet medication, has revolutionized the treatment of cardiovascular diseases. In this guide, we will delve into the mechanism of action of Plavix, its uses, potential side effects, and precautions to be aware of. We'll also explore the latest research findings, the optimal dosage, and how Plavix compares to other antiplatelet agents on the market. With its ability to reduce the risk of heart attack, stroke, and other potentially fatal conditions, Plavix has become an indispensable tool in the fight against cardiovascular diseases. Stay tuned as we unveil the power of Plavix and why it has become a life-saving medication for countless individuals around the world. Whether you're new to Plavix or have been taking it for some time, this comprehensive guide will equip you with the knowledge you need to make informed decisions about your health. What is Plavix and how does it work? Plavix, also known by its generic name Clopidogrel, is an antiplatelet medication used to prevent blood clots in individuals with certain cardiovascular conditions. It belongs to a class of drugs called thienopyridine derivatives and works by inhibiting the aggregation of platelets, which are responsible for blood clot formation. By reducing platelet aggregation, Plavix helps to maintain blood flow through narrowed or blocked blood vessels, reducing the risk of heart attack, stroke, and other cardiovascular events. Plavix is primarily metabolized in the liver and converted to its active form, which binds irreversibly to the platelets, inhibiting their ability to clump together. The antiplatelet effect of Plavix lasts for the lifespan of the platelet, which is approximately 7 to 10 days. This prolonged duration of action makes Plavix an effective medication for preventing blood clot formation and maintaining steady blood flow. Plavix is available in oral tablet form and is typically taken once daily. It is important to follow the prescribed dosage and administration instructions provided by your healthcare provider. Now that we have a basic understanding of what Plavix is and how it works, let's explore the various conditions that can be treated with this life-saving medication. Conditions treated with Plavix. Plavix is primarily prescribed to individuals with a history of cardiovascular diseases or those at high risk of developing these conditions. The medication is commonly used in the following scenarios. Acute coronary syndrome, ACS. Plavix is a crucial component of the treatment regimen for patients who have had a heart attack or unstable angina. It helps prevent further blood clot formation and reduces the risk of subsequent cardiovascular events. Coronary artery disease, CAD. Plavix is often prescribed to individuals with CAD, a condition characterized by the narrowing or blockage of the coronary arteries. By preventing blood clots, Plavix helps maintain blood flow to the heart muscle, reducing the risk of heart attack and other complications. Ischemic stroke. Plavix is used in the treatment of ischemic stroke, which occurs when a blood clot blocks an artery supplying blood to the brain. By preventing the formation of new blood clots, Plavix helps reduce the risk of recurrent strokes. Peripheral artery disease, PAD. Plavix is prescribed to individuals with PAD, a condition caused by the narrowing of blood vessels outside the heart. By improving blood flow to the limbs, Plavix helps alleviate symptoms such as leg pain and reduces the risk of complications such as non-healing wounds. It is important to note that Plavix should always be used under the supervision of a healthcare professional who can assess the individual's specific condition and determine the appropriate treatment plan. While Plavix has proven efficacy in the treatment of these conditions, it is essential to understand the potential benefits and risks associated with its use. Benefits and risks of taking Plavix. Plavix has been hailed as a life-saving medication due to its ability to reduce the risk of cardiovascular events. The benefits of taking Plavix include reduced risk of heart attack and stroke. Plavix significantly lowers the risk of heart attack, stroke, and other cardiovascular events in individuals with a history of ACS or CAD. By inhibiting platelet aggregation, Plavix helps prevent the formation of blood clots that can lead to these life-threatening conditions. Prevention of stent thrombosis. Plavix is commonly prescribed to individuals undergoing coronary stent placement. Stents are small mesh tubes used to prop open narrowed or blocked arteries. Plavix helps prevent the formation of blood clots around the stent, reducing the risk of stent thrombosis, which can lead to a heart attack. Management of peripheral artery disease. Plavix is effective in improving blood flow to the limbs in individuals with PAD. By preventing blood clots, Plavix helps alleviate symptoms such as leg pain and reduces the risk of complications. While Plavix offers significant benefits, it is essential to be aware of the potential risks associated with its use. Common side effects of Plavix include bleeding. Plavix can increase the risk of bleeding, which can range from minor bruising to severe gastrointestinal or intracranial bleeding. It is important to promptly report any signs of bleeding to your healthcare provider. Allergic reactions. Although rare, some individuals may experience allergic reactions to Plavix, which can manifest as rash, itching, swelling, or difficulty breathing. If you experience any of these symptoms, seek immediate medical attention. TTP, thrombotic thrombocytopenic purpura. In rare cases, Plavix has been associated with the development of TTP, a serious blood disorder characterized by the formation of blood clots throughout the body. Symptoms may include fever, weakness, and neurological abnormalities. If you experience these symptoms, seek immediate medical attention. It is crucial to weigh the benefits against the risks when considering Plavix treatment. Your healthcare provider will assess your individual risk factors and determine if Plavix is the right medication for you. It is important to follow the prescribed dosage and report any unusual symptoms or side effects to your healthcare provider. Plavix dosage and administration. The dosage of Plavix prescribed can vary depending on the individual's condition, medical history, and response to treatment. It is essential to follow the dosage instructions provided by your healthcare provider and not exceed the recommended dose. Taking more than the prescribed dose can increase the risk of bleeding and other side effects. Plavix is typically taken orally once daily, with or without food. The tablets should be swallowed whole with a glass of water and should not be crushed or chewed. If you have difficulty swallowing tablets, discuss alternative options with your healthcare provider. The optimal duration of Plavix treatment will depend on your specific condition. In some cases, Plavix may be prescribed for a short period, such as after a coronary stent placement, while in others, it may be recommended for long-term use to manage chronic conditions such as CAD or PAD. It is important to follow your healthcare provider's instructions regarding the duration of treatment. It is essential to attend regular follow-up appointments with your healthcare provider to monitor your response to Plavix treatment and adjust the dosage if necessary. Your healthcare provider may also order blood tests to assess your platelet function and ensure that Plavix is working effectively. By adhering to the prescribed dosage and attending regular appointments, you can maximize the benefits of Plavix while minimizing the risks. Common side effects of Plavix. Like any medication, Plavix can cause side effects in some individuals. While not everyone will experience side effects, it is important to be aware of the potential adverse reactions. Common side effects of Plavix include easy bruising or bleeding. Plavix can increase the risk of bleeding, which may manifest as easy bruising, nosebleeds, or prolonged bleeding from cuts. It is important to inform your healthcare provider if you experience any unusual bleeding symptoms. Stomach upset or indigestion. Plavix can cause gastrointestinal side effects such as stomach pain, diarrhea, or indigestion. If these symptoms persist or worsen, consult your healthcare provider. Headache or dizziness. Some individuals may experience headaches or dizziness while taking Plavix. These symptoms are usually mild and resolve on their own. However, if they persist or become severe, seek medical advice. Muscle pain or joint pain. Plavix may cause muscle or joint pain in some individuals. If you experience persistent or severe pain, discuss this with your healthcare provider. It is important to note that these are not the only possible side effects of Plavix. If you experience any unusual symptoms or side effects not listed here, contact your healthcare provider for further evaluation. Precautions and contraindications for Plavix use. While Plavix is generally well tolerated, there are certain precautions and contraindications to be aware of. Before starting Plavix treatment, it is important to inform your healthcare provider of any pre-existing medical conditions, allergies, or medications you are currently taking. The following precautions should be considered when using Plavix. Bleeding disorders. Plavix can increase the risk of bleeding, and individuals with bleeding disorders or a history of gastrointestinal or intracranial bleeding should use Plavix with caution. Liver disease. Plavix is primarily metabolized in the liver, so individuals with severe liver disease may require dosage adjustments or alternative treatment options. Pregnancy and breastfeeding. The safety of Plavix during pregnancy and breastfeeding has not been established, and it should only be used if the potential benefits outweigh the risks. Consult your healthcare provider if you are pregnant, planning to become pregnant, or breastfeeding. Surgery and dental procedures. It is essential to inform your healthcare provider or dentist that you are taking Plavix before undergoing any surgical or dental procedures. In some cases, Plavix may need to be temporarily discontinued to reduce the risk of excessive bleeding. Additionally, Plavix should not be used in individuals with a known hypersensitivity to Clopidogrel or any other component of the medication. If you have a known allergy to Plavix or similar medications, inform your healthcare provider to explore alternative treatment options. Drug interactions with Plavix. Plavix can interact with certain medications, altering their effectiveness or increasing the risk of side effects. It is important to inform your healthcare provider about all the medications, supplements, or herbal products you are currently taking to avoid potential drug interactions. The following medications should be used with caution or avoided when taking Plavix. Proton pump inhibitors, PPIs. PPIs, commonly used to treat conditions such as acid reflux and ulcers, can reduce the effectiveness of Plavix. If you are prescribed a PPI, discuss alternative options with your healthcare provider. Non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs, including aspirin, ibuprofen, and naproxen, can increase the risk of bleeding when taken with Plavix. It is important to inform your healthcare provider if you are taking any NSAIDs. Selective serotonin reuptake inhibitors, SSRIs. Some SSRIs, commonly used to treat depression and anxiety disorders, may increase the risk of bleeding when combined with Plavix. Inform your healthcare provider if you are taking any SSRIs. Anticoagulants. Plavix should be used with caution in individuals taking anticoagulant medications such as warfarin or heparin, as the risk of bleeding may be increased. Your healthcare provider will closely monitor your response to these medications if they are prescribed together. It is important to note that this is not an exhaustive list of potential drug interactions. Always consult your healthcare provider or pharmacist for a comprehensive review of your medications and to ensure the safe and effective use of Plavix. Frequently asked questions about Plavix. Can Plavix be taken with food? Plavix can be taken with or without food. However, if it causes stomach upset, taking it with food may help alleviate this symptom. Can Plavix be crushed or chewed? No, Plavix tablets should not be crushed or chewed. They should be swallowed whole with a glass of water. Can Plavix be stopped abruptly? Plavix should not be stopped abruptly without consulting your healthcare provider. Abrupt discontinuation may increase the risk of blood clot formation and cardiovascular events. Can Plavix cause weight gain? Weight gain is not a known side effect of Plavix. If you experience unexplained weight gain while taking Plavix, consult your healthcare provider. Can Plavix be used in children? Plavix is not typically prescribed to children. The safety and effectiveness of Plavix in pediatric populations have not been established. Always consult your healthcare provider for personalized answers to your specific questions or concerns regarding Plavix. Alternative medications to Plavix. While Plavix is a highly effective medication, there are alternative antiplatelet agents available that may be prescribed in certain situations. These alternatives include aspirin. Aspirin is a commonly used antiplatelet agent that can be used in combination with or as an alternative to Plavix. Aspirin works by inhibiting platelet aggregation and reducing the risk of blood clot formation. However, it is important to note that aspirin may not be as effective as Plavix in certain individuals. Ticagrelor, Brilinta. Ticagrelor is another antiplatelet medication that works by inhibiting platelet aggregation. It is often used as an alternative to Plavix in certain individuals with AX or CAD. Ticagrelor may have a faster onset of action and greater efficacy in some patients. Thanks for watching.